Today we're focusing on anxiety disorders, a topic that the NCLEX loves to test through priority and intervention style questions. The most critical concept you must master is how to tailor your nursing actions to the 4 levels of anxiety: mild, moderate, severe, and panic. Your ability to differentiate these levels determines the correct answer. For a patient experiencing mild or moderate anxiety, their perceptual field is narrowed, but they can still process information and learn. This is the time for therapeutic communication, active listening, and helping the patient identify triggers. Exam questions for this stage will have correct answers involving teaching coping mechanisms like deep breathing, exploring what the patient is feeling, or encouraging problem solving. However, the most common exam trait occurs when anxiety escalates to a severe or panic level. At this point, the patient's ability to learn or think logically is gone. Your priority as a nurse must shift from education to safety. An answer choice like teach the patient relaxation techniques during a panic attack is always wrong. The patient cannot learn in this state. Instead, the correct actions are direct, simple, and protective. You must reduce environmental stimuli, so moving the patient to a quiet, private space is a top priority. Use short, simple, firm sentences like "sit here with me" or "I am not going to leave you." Never leave a patient in a state of panic-level anxiety alone. Remember this simple mnemonic for severe anxiety and panic: SAFE. Stay with the patient. Assess for safety, both yours and theirs. Use firm, simple commands, and reduce environmental stimuli. When dealing with specific disorders like OCD, the exam will test your understanding of compulsive behaviors. A common mistake is thinking the nurse should stop the patient from performing their ritual. This is incorrect and will dramatically increase their anxiety. The best initial approach is to allow the ritual, but set limits to ensure it does not interfere with basic needs like nutrition or safety. For instance, you would allow the patient to wash their hands, but state they must come to eat their meal afterward. The goal is gradual limitation, not abrupt cessation. For pharmacologic interventions, you must distinguish between benzodiazepines and SSRIs. Benzodiazepines, like lorazepam or alprazolam, are for acute episodes. They work quickly to manage a panic attack. Think of them as a fire extinguisher. The NCLEX will test your knowledge of their side effects, like sedation, and the high potential for dependence, making them unsuitable for long-term primary treatment. SSRIs, such as sertraline or fluoxetine, are the first line, long-term treatment. Think of them as fireproofing the building. The most critical exam point here is patient education about the therapeutic lag. You must teach the patient that these medications can take 4 to 6 weeks to reach their full effect, and they should not stop taking them if they don't feel better right away. An exam question might ask for the nurse's best response to a patient who has been on an SSRI for 1 week and reports no change in their anxiety. The correct answer will always involve educating them about this time frame.